of bodily tissue by pathogenic microorganisms that grow, resulting in injury that can in turn lead to or progress into disease. So the invasion, if you have an invasion of, remember, our body is protected from infection by the first line of defense. The first line of defense is always the skin, the mucous membranes, okay, whatever in the mouth and all those other where the mucous membranes form. So when you have an invasion, then these microorganisms will grow and multiply. Microorganisms such as bacteria, viruses, okay, they grow and multiply where they are not normally present within the body. Some of the body tissues or organs are said to be sterile without some other microorganisms, apart from other places like the mouth, the vagina, where we find the so-called normal flora. So an infection may cause no symptoms. So it may be asymptomatic and be what we call subclinical in epidemiological terms. It may cause symptoms and be clinically apparent. The patient will come with overt symptoms, maybe fever, maybe discharge, etc., etc. So the infection may remain localized to a certain area. Okay, so someone gets a pneumonia and remains localized to the lungs, or it may disseminate to other parts, either through blood, that's what we call hematogenous spread, or lymphatic vessel through the lymphatic system. So those microorganisms that live naturally in the body, the one we call the normal flora, or the resident microorganisms within the body, I told you we have them on the skin, we have them in the mouth, in the nose, in the vagina, in our GIT. So they are not considered infections because they are apparently there. So infection prevention, what is infection prevention then? It refers to policies and procedures used to minimize the risk of spreading infection, especially in hospitals and human or animal healthcare facilities. So those policies and procedures put in place to minimize the risk of spread of infection in hospitals for our case, or for our colleagues, the veterinary people, those animal health care facilities. So infectious diseases are the leading cause, lead more people widely than any other single cause, than cancer, than non-communicable diseases, if you may say. Take an example of COVID. COVID killed so many people within a short period of time. So infectious diseases are caused by germs. And those germs, if you want to say, are tiny things that are found everywhere. So germs are found in the air, soil, in the water. So you can get infected by touching maybe a contaminated surface, eating contaminated food, drinking contaminated water, or breathing in air which has been contaminated with these microorganisms, chassis routes of spread. So they also spread through animals and insect bites, so what we call zoonotic diseases or zoonotic infections. You can get them through kissing, sexual contact, etc. With the invasion of vaccines, proper hand washing, and medicines, then most infections can be prevented. So the germs we are talking about can either be bacteria, viruses, fungi, or protozoa. Of course, bacteria, kingdom, Monera, viruses, they have no kingdom, and then fungi, kingdom fungi. So infection can be primary or secondary. So if we say the infection is primary, then the initial infection with an organism to the host, because if you have a bacteria infecting an organism, an individual, you're getting infected with any bacteria or plasmodium, parasite, or a fungi, then we say that is a primary infection. So an organism infecting the host.